CDC Division of TB Elimination, Communication, Education, and Behavioral Studies branch. This webinar is sponsored by the CDC TB Education and Training Network. However, the findings and conclusions are those of the presenters. Today, we will learn about the County of San Diego TB Peer Educator Project. This webinar will highlight an innovative project designed to teach high school students about TB. The project is part of a collaboration between the San Diego County of Education's Work-Based Learning Team and the County Health and Human Services Agency, Public Health Services, TB Control, and Refugee Health Branch. San Diego High School piloted an 8-week service learning project in the spring of this year. Kearney High School is currently implementing the project. Our speakers today are Marty Brentnall, TB Outreach and Education Coordinator for the County of San Diego, Alejandra Pina Velasquez, Community Health Promotion Specialist for the County of San Diego, and Sonia Lira, Work-Based Learning Project Specialist for the San Diego County Office of Education. So before we get started, just a few housekeeping items. First of all, we apologize for the technical problems, and hopefully everything will go smooth from now on. Today's event is scheduled for 1 hour. We're going to try to get through that, even though we're a little bit short on time. The webinar is being recorded, and it will be, we will promote it and put it on the CDC YouTube channel. And as soon as that's available, I'll send the link out to everyone who registered, and folks who missed it, we will make sure to get the recording to them. You may submit questions at any time using the chat function, and we will have a question and answer session as soon as the presenters are finished. I think that's everything I have. I'm going to turn it over to Marty.
Thank you so much, Perry, and thank you to the CDC Education and Training Network Work Group for inviting us to present on the TB Peer Educator Project today. Next slide, please. As far as our objectives today, we're going to learn about the status of TB in San Diego County. We also want you to understand what the TB Peer Educator Project is. And then we hope that you find ways, you're going to be able to find ways of starting a TB Peer Educator Project in your local health jurisdiction or in your area. Next slide. Now, before we even start talking about the TB Peer Educator Project, we have to talk about how TB impacts San Diego County. Next slide. In San Diego County, we're the fifth largest, we have the fifth most populous county in the we are the fifth most populous county in the United States. We're the second most populous county in California. Our population is a little bit over 3.3 million. Last year, we had 201 active TB cases. And of those cases, 80% of those cases were due to progression of long-term long-standing TB infection that progressed into active TB. And in San Diego County, we have an estimated 175,000 people with TB infection. Only 20% of those are estimated, it's estimated that only 20% know of their status. Next. As far as TB, our TB rates in San Diego County over the years, as you can see, the blue line is San Diego County, the orange is California, and then the green line is the United States. Our rates are twice that of the United States, and then higher than California as well. The most interesting thing about the slide, and when I'm in a TB 101 with students out in San Diego County, I tend to spend a lot of time on this slide because I'm a big history buff, but I won't go into many details here. But as you can see, we have a roller coaster as far as the ebb and the flow of our rates. And that's mostly due to the fact that we are a border county. And we have over 250,000 binational citizens that either were born in the United States and live in Mexico and can travel freely across the border. So that and the emerging refugee populations that also cross the border and also impact our county as far as providing services. Next slide. As far as our active TB, as far as birth country, with our active TB cases in 2021, last year, our 201 cases, the majority of the birth countries were from the United States and Mexico. And again, when you look at both of those portions, you have to consider our binational population as well. But we also have representation from the Philippines and Vietnam, and then other countries as well. That could be China, India, and then the former Russian republics. Next. As far as active TB by age group, as you can see, and I don't need, everybody should know this in their own counties, but TB cases increase as people get older. When we're in the classroom, one of the reasons why we do our TB 101s and our TB Peer Educator project is because we want to get out the word early about TB. So as you see, for our 15 to 24-year-olds, it's only 9% of our cases, still a lot for a county, but it's time. We see that as the time to start talking about TB and getting it in, being part of their health education vernacular. Next. Active TB in San Diego County by birth country last year as well. I think this is the same slide. I think, whoops, there we go. The incidence rates, thank you. As far as the incidence rates by birth country, it's from 2017 to 2021. And as you can see, we get a little different variation as far as what's represented here. While we do have most of our cases from last year, as an example, from Mexico and the United States, as you can see, the Philippines and Vietnam are more represented within our incidence rates. That means we have to diversify our outreach and education, not only to our binational population, but also to our Filipino and Vietnamese communities. Next. And how do we do that? How do we target our outreach and education? Well, we have a hotspot map. And we go and we collect every year. We collect over a 4-year period of time our incidence rates, and we update them yearly so we can look at our zip codes with the highest incidence rates of our TB cases. And as you see, the red represents our highest, our high priority zip codes. Next slide. We've enhanced this map a little bit more because we've overlaid our health equity zip code, our high risk health equity zip codes as well onto our TB hotspot map. So as you can see, those counties that are in red and also a little ladybug type pattern there, those are our highest TB, our highest risk TB areas. And as you can see by those blue stars are where we are we have either implemented or will be implementing the TB Peer Educator project. So this helps us, this map helps guide us on where we should be implementing these projects. Next, please. Now, as far as what does TB elimination look like in San Diego County? Well, next slide. We're very fortunate to have the San Diego County TB Elimination Initiative. This is an initiative that has been recommended and approved by our county supervisors, our county board of supervisors. And the structure of our elimination initiative is an advisory board, a public-private partnership where we bring our healthcare systems and representatives and from nonprofits together to really talk about TB elimination. We're overseen by an advisory board. And then we have 3 committees: the community of practice, that's our healthcare providers. We have the schools committee, and then we have our community outreach committee. And as you can see, our TB Peer Educator project falls under our schools committee. So this is something that we can continue updating the entire county TB elimination initiative on our outcomes and what we're doing. Then under the community outreach committee, we have CARE TB. That is our outreach, our education and outreach, our TB screening, our testing, and then our treatment program that we cater to our Latinx and Asian Pacific Islander groups. And together they work together on some of our projects. Next slide. So what's the history behind the TB Peer Educator project? Next slide. Well, in the beginning is that we did a lot of TB 101 presentations for 8th through 12th graders. And we have had a 6-year relationship with Sonia Lara, who's a work-based learning specialist. She started at a community college in San Diego County, and that's where our partnership started. And then she transitioned over to the San Diego County Office of Ed. She's our agent. She's the person that goes out. She's our manager. She promotes us. She gets us connected to our high-risk TB high schools, or our high schools in the high-risk TB areas. And she's able to schedule us. She's able to schedule us, and through those presentations, meeting teachers and creating relationships. We have just a cherished relationship with her. And then because of this, we've been able to go out to 10 high-risk high schools on a regular basis, on a yearly basis, to be able to educate on TB and basic TB concepts. And in all, we've reached over 1,500 individual students because of this relationship we've created. Next slide. But going out to those high schools, being out and being in front of a classroom for an hour to an hour and a half, talking about TB 101 basic concepts, we just found that it wasn't enough. We really needed more time. Like learning a foreign language, you need to hear a word over 60 times before it becomes part of your ongoing foreign language vocabulary. And that's the same with TB. So we were looking at, and then we saw the opportunity, a lot of opportunities. Number one, high school seniors. They're about ready to go off to college or the military or into health careers. And they're going to be doing TB risk assessments, TB testing. Well, we really wanted to drive home why that's important. A lot of times people just check off those boxes on the risk assessment and they really don't think about what it's all about. And if we educate students more on these TB risk assessments, on the reason for the testing, then they can share that information with others as well. Also, we were in need of feedback. We needed education products, TB prevention education products for the 15 to 24-year-old age group. And what better place is to work with these students and find out what would really work. So as we were teaching the concepts, we really wanted to hear feedback on what would work, what types of things should we do to do outreach to the 15 to 24-year-old age group. And then we also wanted to make it real. I was very fortunate. My kids were in high school in project-based learning pathways. So I knew firsthand, or maybe secondhand, because my kids would tell me how excited they were to be part of a project-based learning experience. So taking what they were doing in high school, I started thinking about how this could be translated into our own project-based learning opportunity. Next slide. We also have a lot of support in California to be able to have this project-based learning opportunity to become real. We have the California State Office of Education does have its own project-based work-based education initiative. So there's a lot of support in our counties to be able to create project-based learning opportunities. In San Diego County, we do have the College and Career Ready Consortium. And also we have Sonia, who's with the San Diego County Office of Ed, and her support. Next. But the challenge was, how do we set up a curriculum? At the time, my former colleague and I were talking about it. She retired, lucky her. But we were talking about the curriculum, how to do it. We were talking about expanding the TB 101, expanding the concepts. And, but we really needed something the kids could get their hands on, the students could get their hands on. And just was fortunate enough that I was working on a reaccreditation committee for our county public health services. The county public health services is accredited by the Public Health Accreditation Board. So we were doing our reaccreditation application, and the domain group that I was leading was responsible for improving the public health services health promotion framework. And reviewing this framework, and one of my team members updated it, and reviewing the framework, I just saw the opportunity to create a curriculum where we could take them through creating a health promotion program and identifying health promotion products, TB prevention related, and being able to for them to take them through that journey of creating that campaign. Next slide. So we took the main components from that curriculum. Knowledge, increasing our goal was to increase knowledge of tuberculosis, understand the difference between infection and disease, identify at least 3 challenges in TB prevention to young adults, and then recognize elements of public health services along with learning about public health careers. Because also when we looked out in the audience, when we did these TB 101s, we saw our future public health workers. But unfortunately, the focus a lot on these health pathways in high schools were focused on hospitals and clinics. So we had to start incorporating public health careers as well, and have them get interested in public health. Next. So as far as the 8-week project, working with the Public Health Services Health Promotion Framework, we started with the objective of creating TB prevention messaging products for people 15 to 24. We worked with small groups in the classroom, and we divided them into zip code areas where they would look at their zip codes and be able to look at the data in their zip codes. We had them review current TB prevention campaigns and have them evaluate them, give feedback on what would work and what wouldn't work for their age group. And again, looking at the data. And then we did brainstorming activity where they came up with product ideas. And that was the coolest thing in the world. Red Dead Redemption 2 kept coming up. It's a video game. and the main character had TB. I mean, what an opportunity to put public health messages in those. Another one was just recent, and Alejandro will go over that, is Paleta ice cream bar, the holder, putting public health messages on Paletas, the ice cream bars that are sold throughout neighborhoods in these high-risk TB areas. Oh my gosh, you know, who knew about this? So these are opportunities that we can take, that the students can create, and then we can also take too and build on as part of within our public, what the powers that we have within public health. And then they were able to test the product. We had them do a community needs assessment, survey their own classmates. And so we got feedback from them as well. Not only did they learn about doing surveys, but then we're getting additional data on what their classmates' opinions were. So we're getting TB and educating TB beyond the classroom. And then they finalized their product. They, from their survey results, they finalized their product. And then we had a community panel. With our pilot project, we brought in some TB branch employees and also representatives from the community to hear their pitches. So they did presentation pitches on their product, and then they received feedback. We found that this was a morale boosting activity for our staff, that a lot are deep into their case management, and being able to take a break and hear how students have learned about TB and their ideas. It was just really a positive event to where we're learning from one another. And then Alejandro will go over this, but we then added a community event as well, so they can do peer education to their classmates and also to their community. Next slide. And then as far as the curriculum rubric, the outline is the TB. First, we start with the TB 101, going over the basic TB concepts. Then we added TB and achieving health equity. This was actually student input from our pilot of improving our curriculum, and that was very helpful for us. Then we did data exploration. Then we talked about how to get your message out to your peers and the ideas, and then creating a TB prevention, a peer prevention prevention campaign. And then again, doing the first draft, doing the final draft, and then doing their outreach activity. And next. And then, once we got the curriculum together, then it was, how do we get it out there? Again, with Sonia as our agent, she's very helpful. And together, she and I had this idea, we were going to do an interest form. We were going to send it out actually a year ago, last year. We had a $25 Better Buzz gift card that I bought to be able to get people that was interested in our program. So we sent out a blurb to her distribution, to Sonia's distribution list. We had the drawing, we had them fill out an interest form, and now we have a list of 15 teachers that responded and that are interested in not only maybe just a TB 101 or the TB Peer Educator project itself. Next. And then as far as the San Diego High School, we were just really fortunate that with us, one of the teachers was willing to do the pilot project. And we were just fortunate enough that she teaches at San Diego High School advanced English and Intro to Public Health combination class. And in the fall semester of 2021, her students read Mountains Beyond Mountains, and by Dr. I always get his name wrong, but Mountains Beyond Mountains by Dr. Paul Green, I believe. And so they were able to take the reading of that book and then into the curriculum, into the TB Peer Educator project, and it made it even more real for them. We had the pilot in spring of 2022. It was 36 students, 6 groups of 6. And then with doing the pilot, we were able to do an evaluation. We got feedback, and it was just valuable feedback that we put it back into our curriculum that we just did at Kearney High. I was very fortunate in the middle of this pilot implementation to hire Alejandra Pena Velasquez. And so she took it over from here. And then as far as the curriculum development, working as a team, she now goes into the classroom and does the implementation. So I'd like to hand it over to her and for her to talk about our latest Peer Educator Project event. Thank you.
Thank you, Marty. And may we please go next slide. So as Marty mentioned, I partly, she helped me, she guided me the whole way through to get to the point where I'm at now. And she also taught me about the curriculum, and we had an opportunity to take that input from San Diego High School and make those changes and incorporate them at Kearney High School. And at Kearney High School, we actually just finished the project just this month, at the beginning of this month. So it was really a great opportunity to see how the students have had an opportunity to grow throughout the process. And we did it alongside Miss Ogo, who you can see on the call here. And we worked with, and she's a part of the School of Biomedical Science and Technology at Kearney High School. And there we worked with 30 high school seniors, and we did 7 lessons and a community outreach event. So one of the great opportunities about this community outreach event is that the students each had an opportunity to go through that public health framework and kind of put all the pieces together based on the objectives that were set for them. So in doing so, they got their TB 101 lesson in, but then they also learned about health equity and learned about the impact that surrounds our areas and some of those high risk areas based on our zip codes that have higher rates of TB. So they created different products, and they were able to see the whole public health process by participating in this community event. So after they finished up their project, they showcased all of their work at the Harvest Health Fair, which is a health fair that took place at the Linda Vista Farmers Market. This community event was done in conjunction with CARE TB screening and testing. So you saw that in the very beginning when we're looking at that task force. The CARE TB is a part of our community outreach task force. So this is how we work together within the community, and the students were able to see how the screening is such an important part, and they were able to see us do the risk assessments, and they were able to provide that health education to anyone who participated and stopped by at their table. So again, some more examples here. We had, they talk about being youth, and one of the things youth love are getting freebies, right? So they talked about doing t-shirt giveaways, but using it in conjunction with a wheel and being able to ask questions to the general public and being able to do giveaways. So these are just a lot of the ideas that came up. Marty also mentioned the popsicle sticks. So it's like when you get like a fun fact on a popsicle stick. So these are all ideas that our students have, and that, sometimes they do not cross your mind. It's like, I wouldn't have thought of putting a fun fact on a popsicle stick, but the students do. And these are some of the examples as well that they were able to create. So we have a group here that created an infographic that shows 4 ways to stay informed about tuberculosis. And again, you can see that they lay out the difference between latent and active TB. They also provide testing sites. So we always talk about like being able to provide those next steps to improve health equity. And one of the ways that we do that is by presenting information in a simple manner, easy to read, easy to understand, but also being able to provide them the next steps, right? A lot of times people are like, well, I don't know if I have TB, or I don't know if I have active, or I don't know if I have latent, being able to get the information in this way, but then also knowing where to get tested and where to receive resources, right? And I know it's in a very small text here, but they have also included the pricing that they found. So they're able to show that that some of the TB testing can be at very low cost or free in certain situations. But of course, we always remind them, make sure they just always check in with wherever they're getting tested, because there may be other variables like health insurance, right? So yeah, so as you all saw in the video, that one of the things we talk about a lot is destigmatizing TB. And one of the ways that the students incorporated that destigmatization of TB was by adding a little bit of humor to it. They also said that it was a great way to be able to reach students and individuals that are between the ages of 14 and 24. So they created this video, and also one of the main elements of our peer educator project is in the name, right? Peer-to-peer education. So they actually had to go out and educate those students first and talk to them about TB in order for them to be able to respond to those questions accurately, right? So they went out and did just that in their presentation. So it's just a great way to see how they have progressed, and they've gone through the whole process of that framework, and they are even working towards destigmatizing what TB is. Thank you. Can we do next slide? And again, I know that I already brought this up a little bit, but at the Linda Vista Farmers Market. So again, with the peer educator aspect of it, right? I noticed that there were a lot of students there, and there were also students that were not a part of their own classroom, meaning that they brought in their friends from outside, and they said, hey, we're going to do this project, this activity, and they got to see firsthand the importance of partnerships, right? I know that one of actually on the TikTok page, you can see that they partnered with their own classmates, because we also talked about partnerships, and they have their cross links to their classmates' Instagram that they created about TB prevention. So then they got to see these partnerships firsthand, where we worked in partnership with Care TB and alongside Care TB and Champions for Health, where they are the ones that are able to do the flu and COVID vaccinations. And then we also worked on doing the TB risk assessment and testings. And then they had that opportunity again to showcase their peer educator project. And they brought more students, and they brought more peers in and demonstrated their work. So it was just an incredible activity to see. Thank you. May we go next slide? So as you saw the whole process now, right? We saw starting from the history, but now we're going to be looking at some evaluation outcomes, right? So one of the things that we really wanted to do is to increase TB awareness. And one of the ways that was established was through a pre and post test. So the students all did a pre and post test, and they all noted that I'm sorry, let me rewind a little bit. So we wanted to see what their awareness was, right? So the TB Peer Educator Project increased students' awareness. So this part was done through the evaluation, and we saw that more than 76% agreed or strongly agreed that the project increased their awareness. Now, when we're looking at increased knowledge, here's when I'm talking about the pre and post test. So with the pre and post test, we saw that based on the matched responses, there was an 18% increase in knowledge. And it also improved the student's ability to educate their friend. And this is again based on the evaluation, where 94% agreed or strongly agreed that it provided them ways to educate their friends about TB. May we go ahead and go on to the next slide? So this brings us over to our teacher panel, and Marty, our student teacher panel, so I'll pass it on back to you so we can go ahead and take care of the panel. There we go, previous slide. Thank you. Marty, you're muted.
And Alejandra, are you going to go ahead and introduce the students and with the panel?
Oh, absolutely. So today we have our participants are all from Kearney High School. So we have Miss Ogo here. She is our wonderful teacher that allowed us to participate in her classroom and present to her students for 8 weeks. And then we also have Bobby and Yoselin. We have 2 students here. So Bobby, it was in the group that created the t-shirt that we saw with the lungs and the rib cage going around it. And Yoselin, as you probably noticed her in the video, she was in the group that created that TikTok video. So thank you.
All right, we'll just go ahead with, to start off with, what was your experience? What was your takeaway from participating in the TV Peer Educator Project? And first, I'll start with Bobby.
Mic check, mic check. Can everyone hear me?
Yeah.
Cool. All right. Well, first of all, I want to say thank you for having me here. I would like to thank Alejandra as well, Marty, myself, Yoslin, and Mrs. Ogo, and everyone else that is here. And yeah, just to introduce myself, my name is Bobby, and I'm a senior at Kearney High School. And my experiences with this peer project, I think what's really unique is when we get to explore what TB is initially, or what finding what TB is, and then actually getting to do the process. And that process is where the magic happens of all the creative and different ways of how we actually reached out to our peers and talked about TB. I think some of the things that I've noticed as um, TB seems to be overlooked at times. And with this peer project, what it really did was it opened us up to what TB is, but also get to explore the different multifaceted areas, for example, with it being zip codes, for example, how certain zip codes may be affected compared to others, but also getting to work in a group with one another and finding different ways to actually explore those ideas and whatnot.
All right, fantastic. Yoselin, how about you?
So me, I'm gonna say thank you too. I'm so thankful that I'm here because it's like my first time being in one of these meetings. And I also go to Kearney School of Biomedical Science and Technology. And I mean, I want to say that from my experience in the program, I learned a lot. I feel like I was never really focused on what tuberculosis had brought to our community, and I wasn't really aware of the damage that it was causing. And shown me using we use TikTok as a platform to promote TB awareness, and we actually got a lot of viewers in it. It was over 1,000 something viewers, and we reached a lot of people because we did post it on TikTok, and so it was more of like everybody. It was not only our age group; it was more people of that age, and I don't know. I just learned a lot, and it was just a really nice experience to like be able to educate my friends about it.
Thank you so much. And to
Yeah.
you, Ms. Ogo, and Yoselin and Bobby, I was telling Ms. Ogo just, I think a couple of days ago, we read your evaluations, your class evaluations, and your input and your ideas were so thoughtful, so mature. So it helps us. It helps us build that curriculum. So I wanted to thank you, but I also want to thank Ms. Ogo for her teaching. She's been with this group for 4 years at the high school, and we are just so impressed with what we saw at the high school. And Ms. Ogo, same question for you. We know that you're not graduating from high school this year, but as far as what was your takeaway from the project?
First of all, I'd like to say thank you to Sonia, because Sonia is the person that introduced you to me, and I was the recipient of that Better Buzz gift card, so thank you for that. And so when we met Marty, I thought the project seemed amazing, and my focus is always trying to expose students to all the careers, and when they come into our biomedical pathway thinking either doctor or nurse, and I wanted to expose them to other opportunities, specifically in public health, because I think that students don't know about it. And so this was a great opportunity for them to do a real world campaign with you, and but also learn about the careers that they can get involved with. And as you can see with Yoselin, that inspire her to maybe pursue a career in public health, which is amazing. So I appreciate all of that. And Alejandra was absolutely amazing. I'm gonna miss her so much. I can't wait till she joins us again next year, because she was fantastic.
Just to identify our additional sites, we are working with other high schools in getting the the peer educator project, the TV peer educator project there. Alejandra right now is working with San Isidro High School. That is a border high school, a high school along the border, where she's working with the medics club. And what's neat about the project is that we can be flexible. So where at Kearney High and San Diego High, we did an 8-week, a 7 and an 8-week curriculum. With San Isidro, their best fit with the Medics Club was through the entire school year. So Alejandra is going out there monthly, monthly with the Medics Club to go over the curriculum, but starting in October through May. So those are our challenges, and those are things that we're working on. And then also working with Morse High School and Sweetwater Union High School, again, in our high-risk TV areas. And next slide. And then we're to the questions part. And Zakia, I don't know if you're going to read out the questions or if people are going to raise their hands. What I will do, I will facilitate the questions to the appropriate people that are on our panel.
All right, great. We have our first hand up, Perry.
I just want to say thank you so much, Jocelyn and Bobby. You guys are just fantastic. It's so impressive. My question is, on the TikTok videos, what was the sort of feedback you got from the general public?
Jocelyn, do you want to go ahead and answer that, please?
Yeah, of course. So our objective was to target 15 to 24-year-olds, and like what not better use of TikTok, because I don't know if you guys know this, but TikTok is usually everywhere. It's on Instagram, it's on Snapchat. Even if you're not even scrolling to TikTok, there's videos, you know, of that platform. And so all of us use TikTok. Miss Ogo, Bobby, I created him an account. Okay, he's using TikTok. And so obviously we want to follow up on trends because that's what, you know, students want, and they want to be, you know, they want to see like comedic scenes, because as like the video showed, we did use some comedic scenes, and we also use rubber duckies, because why not give out rubber duckies to people who answer the questions correctly, just so that we can have our audience, you know, interact with our video. And we did get a lot of views. We got like 1,000, like over 1,400 views or 200 views. We got a ton of shares. I made sure that everybody shared that video because I really wanted to spread awareness. I was like really passionate about that. My friends as well. It's not only me, it's, you know, I had wonderful friends, you know, share that video as well to get more of a bigger audience. And I guess using TikTok was really the only way where I can spread awareness about it, because everybody's on TikTok.
Any other questions?
So it looks like we also have a question in the chat. Allison says, every part of this was so impressive, it's hard to know where to start. I hope we can keep Bobby and Jocelyn interested in public health. Is there a way to see more of the resources the students develop? I'd love to see the posters, shirts, etc. up close and learn more about the GIS story map.
That's a wonderful question, and I'm going to let Alejandra answer that regarding we're updating our branch website, and I'll let her share how we're going to promote these materials.
Absolutely, Marty. So one of the things that we have in progress is that we are updating our website. So one of the things that we notice is that a lot of our community members and colleagues and partners, they want to explore the different elements that were the different campaigns that were created by our students. So one of the parts that we're incorporating into our website is that we're going to create a student library where you can see their TB prevention product on the library on the website. So you will be able to create all of those things that are created. Of course, that is something that is in the works. So in the meantime, if you would like to connect with me, I will have my contact information at the end. You may connect with us at the end, and we'll be able to share that information. I also see that Bobby also shared the link to the story map. So if you would like to take a look at the story map, that is available on the chat box. Thank you, Bobby.
And to add to that, we are going to have QR codes. So we're talking about the QR code to the t-shirt, but also we can put the QR code onto those the products that they do make. So that takes them back to our TB Control and Refugee Health Branch website. And then they can go to the TB Peer Educator project. And then they can also, explore what we're doing with TB elimination as well. In San Diego County. So it's everyone benefits.
Can I add something? In regards to Allison's question, where you mentioned it's hard to know where to get started.
Sonia.
I'm just wondering if we could do, so I kind of feel this presentation is just like getting our feet wet, but if we could put together an actual train the trainer for the educators or anyone who's interested in doing this, where we get more into detail on what's involved in the curriculum and just any other helpful information about how to connect with educators, how to connect with their local HHSA. So just more details. And maybe it doesn't have to be a webinar. Maybe it's something that we could just record and then just blast out.
Absolutely. And there's also a contact slide in our next slide. And Sonia, my apologies. Like I said, she's our agent. She's the one that connects us. And I really highly suggest for anyone that would like to do this project in their local health jurisdiction is to find those same resources. And there's our contact information to find work-based learning resources within your county school district, within your city school district or state Department of Education, and start from there because they're looking for people to work with as well. And like I said, Sonia's been nothing but helpful for us in getting us out there and meeting our objectives in educating students in high schools about TB.
Trying to unmute. You all made it easy for me, Marty and Alejandra. I mean, I wish I can take credit, but I mean, just the work. And I wish that this audience could see the curriculum just in detail. Maybe could we email it out or could we put it in the chat? Is that for the public to view? Because there's just so much involved.
Yeah, we can share any information. You can reach out to us. We'll share our education guide and answer any questions that you may have. And I mean, of course, and we want to hear from you. If you do develop it and implement it, we want to hear the feedback back on additional ideas. Let's build on this. In fact, we're working with our public health services department, the branches in our department. We have 7 branches and we have a work group now on peer and doing peer education and talking about doing a boot camp on a campus this summer. Hopefully with that opportunity. Sonia, you probably saw that email today where we're hoping to connect and work together with our other branches. Because as much as we would like to take all the time for tuberculosis, what we also saw was opportunities for other public health efforts to go out and do this education as well. Mental health, HIV, STD, there's just so many opportunities out there to create a peer-to-peer educator project.
Well, and I just think it's a fantastic idea. I mean, what a better way for people to learn and get students engaged and let them come up with their own ideas about, how their own strategies. I think it's wonderful. And I just want to thank you all for all the work you've done and the contributions you're making to your communities. So
thank you so much, Perry. Looking forward to seeing you at a conference soon.
All righty. Well, we are going to close out. Thanks again, everybody. And we will talk to you soon. Bye-bye.
Right. Thank you. Bye-bye.